بسم الله الرحمن الرحيم والصلاة والسلام على خير الأنام سيدنا محمد وعلى آله وصحبه وسلم. Welcome a new lecture of pharmacology of cardiovascular system. Today we'll discuss inshallah the last lecture, which is about the heart failure. And as usual, we start by a definition. What is heart failure? Heart failure, as a general concept, it is inability of the heart to pump sufficient amount of the blood, which is enough for the body needs. بمعنى the heart cannot pump enough blood. Maybe the heart is sick, or the body need more blood. And also scientifically it is defined as a clinical syndrome caused by anatomical or structural functional impairment or ventricular filling or ejection of blood. بمعنى بيكون في مشكلة في الفانكشن او الستراكشر of the heart function زي الاريزميا وكده. it prevent the heart from pumping the blood، وبيبقى عندنا فيه مشكلة دي functional او structural. يكون عندنا aortic rigor، mitral rigor، stenosis or a heart muscle disease زي myocardial infarction. This will lead to impairment of the filling of the heart او ejection of the heart. طبعا is a common disease. About 2% of the American develop heart failure. Most of them are old patients, more than 70 and 75 years old. And it's common in African American more than other. So this is the introduction for the heart failure. طيب. As we said in the introduction, it is a problem for the heart. It could be functional or structural, which associated with increase of preload or afterload or disease of the heart. طيب. What is the pathophysiology of the heart failure? طبعا the main problem with the heart failure is the progression of the heart failure. So when we discover a patient with the heart failure, after a while and within time, the patient is progressed from level or stage 1 or stage A, become stage B, and then C and D. We have 4 stages for heart failure and become advanced heart failure. This is mainly due to progression of the heart failure. طيب. Why it is occur and what is the pathophysiology of the heart failure? The main problem with the heart failure is a compensatory mechanism of decompensated heart failure. يعني البيشنت لما يكون عنده decompensated heart failure, the heart cannot pump enough blood. It will activate the sympathetic nerve. Yes. It will activate the sympathetic nervous system, which is increase the adrenergic activity. This will lead to increase of heart rate and blood pressure and increase the contractility. The body try to increase the cardiac output because there is a heart failure. لكن the body stress the heart by increase the heart rate and increase the contractility. Also with activation of the sympathetic nervous system, the blood pressure and resistance will increase. The second thing, that the perfusion for the kidney will decrease. This decreased renal perfusion will activate the RAS system. A RAS system, as you know, renin, angiotensin, aldosterone system, it will activating which is called as angiotensin 2. بيزيد لنا حاجة اسمها angiotensin 2 and increase the aldosterone, which is lead to vasoconstriction by angiotensin 2 and lead to yes. Yes. رضا. رضا. Just a minute to mute him. Yes, he is mute. طيب قلنا there is activation for the RAS system. A RAS system that found in the kidney when the kidney perfusion decrease due to heart failure or other causes, it will activating this RAS system. The purpose of RAS system is to increase the perfusion of the kidney. How? By cause a vasoconstriction and cause a sodium and water retention. This RAS system is depend on angiotensin 2, which is cause a vasoconstriction and induce the secretion of the aldosterone and also the aldosterone, which is increase the sodium and water retention. This will increase the preload and increase the afterload. And within time, this causes something known as a remodeling of the heart itself. So the angiotensin 2 and aldosterone start to change in heart and heart muscle. When the heart become hypertrophied, uh, and become a cardiomegaly, this big heart need more blood supply, and there is no enough blood supply. It will lead to ischemic area, which is healed by fibrosis. This healed area will become fibrosed and non-functioning area, which is lead to progression of the heart failure itself. That is why, as we said, the heart failure is progressed within time. So the process or the compensatory mechanism of the body will increase the heart failure itself and progression of the heart failure itself. This is important point in treatment of patient with heart failure. In heart failure, our treatment is to work, relieve the symptoms and prevent the complication, which is the لانه we many times we can't treat the underlying cause of the heart failure, so there is no definitive treatment. We treat the symptoms, relieve the symptoms, and prevent the complication, which is the progression of the heart failure. So we use a drug which is prevent this compensatory mechanism for the activation of the sympathetic adrenergic activity. We can give something block the beta receptor, so we give beta blocker to prevent the adrenergic activity. And for the RAS system, which is activated in the kidney, we give something to inhibit this RAS system, so we give ACE inhibitors and ARBs. And this is the main drug which is used in treatment for the heart failure. Also, we give something to stop the aldosterone, like the spironolactone, which is treats the hypersecretion. And now we have a new drug known as SGLT, sodium glucose transporter inhibitors, and we found a high relation between the decrease of mortality and this drug. This is the most important point to understand how we use the drug and which drug could be used. When we discuss the drug, just we will discuss how the drug is work, what is the contraindication, like in the general concept is from here, from the pathophysiology. طيب, the non-pharmacological intervention for heart failure. What advice should be given for the patient? The patient is advised to, or we encourage the exercise, healthy diet, stop the alcohol and smoking, and the patient self-care. The patient should do a daily monitoring for the weight. The weight will reflect the edema associated with the heart. طبعا the heart can cause two types of the congestion. If there is a right side heart failure, so the blood cannot return to the heart, and the blood will be in the body system, which is lead to edema, hepatomegaly, and like this. And if there is a left side heart failure, the blood will be congested in the lung اللي هو بيعمل لنا lung congestion. And likely we have a congestive heart failure which has both right and left heart failure. عشان كده البيشنت بيكون عنده the both symptoms. This could be reflected by the weight of the patient. So daily monitor of the weight, it reflects the progression of the heart failure. زي ما قلنا to relieve the symptoms we need something to excrete the extra fluid, so we give the patient the diuretics drugs. طيب.
Doctor, pulmonary edema is right or left side heart failure?
Left heart failure. Pulmonary edema associated with acute heart failure for the left side, and it is after the congestion. يعني بيحصل للpatient pulmonary congestion, increase the hydrostatic pressure inside the blood vessels, leading to extravasation of the fluids to the interstitial tissue of the lungs, which is lead to pulmonary edema. طيب. Very good question. طيب, adjust diuretics زي ما قلنا, we have to give diuretics to decrease the extra fluids in the body, and we have to adjust the dose depend on the symptoms of the patient. The other intervention, we try to prevent the acute or chronic heart failure, which could be related for the infections or other concurrent disease. بمعنى البيشنت بيكون عنده heart failure, بعدين في المستشفى هيجيكم you discover the patient as a heart failure, for example stage A or stage B, and the patient is taking the treatment and going home, then coming after months with acute or chronic heart failure, aggravate the symptoms of heart failure acutely due to disease. البيشنت ممكن يكون عنده infection at that time which is lead to acute heart failure, او البيشنت يكون عنده other concurrent disease زي البيشنت حصل له myocardial infarction, other which is lead to acute or chronic. We treat this acute or chronic heart failure with treatment of acute heart failure, and we adjust the medication of the chronic heart failure. Then discharge the patient to the home. Then the patient continue with the heart failure, again coming acute or chronic, and within time the patient progress. يعني كان في stage B, coming in stage C, and then late coming with stage D, if the patient doesn't take the treatment as advised. The main problem هتكون إنه the patient doesn't take the drugs or the treatment because they make a relation between the symptoms and the drug itself. The drug is not to relieve the symptoms. Just we have one or two drugs, we use them to relieve the symptoms. Almost all our drugs is prevent the progression of the heart failure. So the patient should continue to take the treatment continuously. If the patient stops the treatment, the heart failure will progress rapidly. You have to advise almost all the patient about you have to take the drug continuously. طيب, also زي ما قلنا we have to treat the comorbid with the heart failure if the patient has a hypertension, diabetes, anemia, or obese patient, or obstructive sleep apnea. Just from here we have to understand the general concept of the heart failure. We don't discuss now up to now the drugs. We have to know how we can treat the heart failure. طيب, this is the general principle of heart failure management. Firstly, as we said, the treatment is not to relieve the symptoms. The relief of symptoms, we have one or two drugs, like in the drug targeted to prevent the progression. So if the patient is improves the symptoms, we will not lower or stop the dose of the drug. So we titrate the dose to highest dose or to recommended dose without concerning about the symptoms improve or not. يبقى لو البيشنت جانا بنديه الدواء ونبدا نزيده له changing the dose within 1 week or 2 weeks every 1 or 2 weeks till reach the recommended dose, even if the symptoms is improved. So we have to continue. We have many types of heart failure. We depend on classification of heart failure or stage. How we have levels and we have ejection fraction. If you know ejection fraction اللي هو يعني the amount of the blood pumping by the heart itself uh, uh, related to the amount in the diastolic phase. يعني كمية البلد اللي بيحصل له بامبينج بالمقارنة مع كمية البلد اللي أصلا كان موجود. So if we have 100 ml and we ejected or pump 60 ml, we said there is a 60% ejection fraction. The ejection fraction could reflect the heart failure, and we can divide or classify the heart failure depending on this ejection fraction. We have preserved ejection fraction, that the ejection fraction within or near to normal اللي هو بيكون above 50%. And we have reduced ejection fraction. This ejection fraction is below the normal level and it is below 40. If the ejection fraction is between 40 and 50, it is reduced, like in mildly reduced. So we call them as mild reduced ejection fraction. In some patients, when we start the treatment and the patient follow the lifestyle, it may improve the ejection fraction. So we call them as a heart failure improved ejection fraction. طيب. And here some recommendation about the drugs which is used in each type. Just we have to understand the concept زي ما قلت لكم. The diuretics is recommended for all patients who has a symptoms of congestion, regardless of the left ventricular ejection fraction. وبالتالي diuretics is to relieve the symptoms. So whenever the patient has symptoms, we can give the diuretics. And we have to avoid the drug which is harmful drugs which is increase the heart failure or can precipitating acute heart failure. We will discuss this drug in next slide. And in a special population, we have to adjust the treatment depend on them, the patient in pregnancy and lactation. This is the drugs which should be avoided. The most important drug is the calcium channel blockers. As you know, the calcium channel blockers is used in hypertension, arrhythmia, and in cardiovascular disease, in angina. Like in heart failure, we don't use the calcium channel blockers. We avoid calcium channel blockers, especially the calcium channel blockers which is affecting the heart اللي هي اسمها non-dihydropyridines. Also, the non-steroidal anti-inflammatory drugs. The non-steroidal anti-inflammatory drugs like ibuprofen, aspirin, and diclofenac, and these drugs can cause a sodium and water retention, which is aggravating the case. The other drugs, commonly the patient who has a heart failure has a diabetes, وبالتالي may using a drug which is used in diabetes. We have a group known as thiazolidinediols, and we have a group known as DBP4 inhibitors, which is end by gliptins, saxagliptins. This drug should not be used. We have one drug is recommended in heart failure, in diabetes, and these two drug or two group is avoided. طيب. The pharmacotherapy, how we manage the patient, which drug should be used زي ما قلنا in treatment of chronic heart failure, which we will speak about. We try to prevent the progression of the heart failure. How? By using a drug which is prevent the remodeling of the heart. It prevent or stop the sympathetic nervous system, and the drug which is stop the RAS system of the kidney. So if the patient has no symptoms and the patient is stage B, A and B, so we can use in A, likely we don't use a drug, that we monitor the patient. In B, we use a drug which is prevent the sympathetic nervous system, like the beta blockers, and drug which is stop the RAS system, like ACE inhibitors and ARBs, as we discuss in hypertension. Type. And we have uh, stage C and stage D. Most likely the patient has a symptom. So we have to use a drug which is relieve the symptoms and increase the intensity and potency of the drug, which is prevent the progression of the disease by adding more drug for this uh, for this drug اللي هي previously discussed البيتا blockers والACE inhibitors كانت في stage B. This is all this process known as a guided directed heart failure therapy. Right. If the patient is stage C and D, we use both beta blockers and ACE inhibitors. Like in stage B, we added diuretics to relieve the symptoms. We add the sodium glucose transporter inhibitors, and we add mineralocorticoid receptors antagonists. This drug like spironolactone, and it is بيسموه aldosterone antagonist. It stops the aldosterone. So we will stop the angiotensin and we stop the aldosterone. And all these drugs, except the diuretics, is decrease the mortality. So the RAS inhibitors, beta blockers, SGLT inhibitors, and mineralocorticoid inhibitors can decrease the morbidity and mortality of the patient. The diuretics is not changing the mortality and morbidity, not changing the progression of the disease, just relieve the symptoms. Also, we have a drug, other drug known as digoxin, also just improves the symptoms. So this is the management of the heart failure. طبعا this is associated with reduced heart failure if it is preserved ejection fraction, means there is a heart failure but still the cardiac output and ejection fraction is enough, وبالتالي just we try to relieve the symptoms and slightly with يعني not a very hard drug, just we try to prevent the progression. So we use SGLT inhibitors, which is increase the excretion of the glucose through the kidney, which is followed by water, so also work as diuretics drugs, and it is decrease the progression by unclear mechanism. The loop diuretics, which is a potent diuretics like furosemide, and this drug is relieve the symptoms. Optional, we can add more drug for the patient to prevent the progression زي الميرالوكورتيكويد receptors antagonist or some of ACE inhibitors or ARBs known as ARNI. It is a combination of two drugs relieve the or prevent the progression of the disease. So this is the general concept of the heart failure. If it is clear, and now you know how we can manage the heart failure, we can start to discuss the most important clinical points about the drug. Any question? Fine. If no question, let us to discuss the drugs one by one. We starting by the diuretics. And diuretics, as you know, we use diuretics in treatment of hypertension, and we use the thiazide as a main drug for treatment of hypertension. Here in heart failure, we use the furosemides, which is loop diuretics, as the main drug for all patients. And we adjust the dose depend on patient status. If it is not working well, so we can add the thiazide for diuretics. So the main difference here, we use the loop diuretics, furosemide as a main drug. Also, this drug, طبعا, the diuretics can decrease the symptoms or relieve the symptoms. Only one of the diuretics which has a weak diuretics effect, like it can prevent the progression of the disease. This drug known as a potassium sparing diuretics اللي هو قلناه قبل شوية mineralocorticoid receptor blocker. This drug is block aldosterone. It is aldosterone antagonist known as spironolactone. And as we say, aldosterone is related to increase the preload by increased sodium and water retention, and it has a role in remodeling effect, which is affecting the heart itself and increase the progression of the disease. So, in patient with C and D stage, we have to use this drug as a part of the protocol of the treatment. So, treat the hyperaldosteronism, associated secondary hyperaldosteronism, and attenuated the remodeling of the heart زي ما قلنا. Also, it can counteract the hypokalemia. The aldosterone, when secreted, it can cause a hypokalemia. So the patient may develop a hypokalemia. Also, the diuretics, the furosemide, loop diuretics, and thiazide, when we give the patient the drugs to relieve the symptoms, also they can cause a hypokalemia. So to make a balance and to prevent the hypokalemia, which can affecting the heart itself, we can give this drug. Right. The question here, what is the main role of diuretics in treatment in chronic heart failure? If you understand the discussion, you can answer the question. The second important drug is beta blockers. And as we said, beta blockers is important for all patients with heart failure. It blocks the sympathetic receptors, the beta receptor, so prevent the progression of the disease. So the drug is recommended for all patients with a heart failure, with a chronic heart failure. Like in the patient should be euvolumic, stable patient. Why for? Because if we have a patient with acute heart failure and now the cardiac output decrease, the patient in acute heart failure with severe symptoms, the heart is full of blood, the heart cannot compensate, cannot pumping the blood. If we give a beta blockers in this case, it will decrease the heart rate and decrease the contractility. This will lead to aggravating the case, aggravating the acute heart failure. So we will wait up to the patient become in a stable stage, chronic heart failure. As soon as the patient is stable, we can add the drug. Like in not use in acute heart failure. In acute heart failure, we use other drugs which has a positive effect on muscle of the heart muscle and heart rate. This is a drug which is used and by olols اللي هو we use metoprolol, bisoprolol and carvedilol. طيب. So this is the use of beta blockers and importance of beta blockers. Does beta blockers recommended or contraindicated in heart failure management? Also, you can answer the question if you understand the beta blockers. This is a major part of the drug. Then we have a very important drug. We will speak about the positive inotropic drugs. Inotropic drugs means the drugs which is give يعني لما نقول when we said inotropic we means the heart contractility. So if we said a positive inotropic drug, that means the drug increase the contractility of the heart. When we said a negative inotropic drug, that means the drug is decrease the contractility of the heart. When we said chronotropic, we will speak about the heart rate. So if we said a positive chronotropic drug, that means the drug increase the heart rate of the heart. And if we said a negative chronotropic, that means the drug decrease the heart rate of the heart. But these drugs, قلنا positive inotropic drugs, means the drugs which is increase the contractility. The first and most important one in international exams, in all exams about the heart failure, is known as a cardiac glycoside, digitalis, and dioxin. And this drug is the most important in international exams. In clinical, it is just a drug used for treatment and relieve the symptoms in chronic heart failure for patient not responding to other drug or in a special case. So it is not commonly used like the other drug. Like in exams, it is a very important drug. And when we said digoxin, we said a digoxin toxicity. This drug has a narrow therapeutic index, and we have many factors that can induce the toxicity of the drug, which is lead to arrhythmia. If you remember, we discussed the drug as anti-arrhythmic drug. One of the major problem is anti-arrhythmic drugs that they cause arrhythmia. So the drug can cause arrhythmia, can cause toxicity just if we increase the dose and even within therapeutic dose with other factors. So whenever they ask about the dioxin, they ask about the dioxin toxicity, factors increase, symptoms, how we can uh, confirm the diagnosis and how we can treat the patient with
Doctor,
dioxin toxicity. Yes?
I have a question. This inotropic is used for chronic heart failure only, right?
Yes.
Okay, what we will use for acute? Because also the beta was for the chronic.
Yes, very good question. We have positive inotropic drugs, زي ما قلنا. We have a different type. The first one is this one, اللي هو cardiac glycosides and dioxin. It is used to relieve the symptoms in chronic patients. In acute heart failure, we need to use inotropic drugs, like we have other drugs. Will be discussed after this one. Okay?
Okay, doctor.
Thank you for your question.
Thank you for answering.
طيب, the mechanism of action of the drug. Simply, the drug is try to increase the calcium inside the heart cell, which is increase the force of contractility. How it increase the calcium? It is inhibit, which is known as a sodium potassium ATPase pump. In sodium potassium ATPase pump, the cell uh, exit the sodium from inside and enter the potassium to inside. If it is stopped, so the sodium will be in high amount inside and the potassium will be in high amount outside. This stop of the or inhibit of sodium potassium ATPase pump lead to inhibit azole pump known as a calcium sodium ATPase pump. Now the sodium is high amount inside, so we can to enter more sodium to inside. In calcium sodium ATPase pump, the calcium is exit outside the cell and the sodium enter inside the cell. But because we have more sodium inside, the process will stop. So the calcium will be inside. It will not be exit outside the cell. So it will lead to accumulate of calcium inside, which is forcing the contraction of the cell. So in conclusion, the process starts by inhibiting the sodium potassium ATPase pump, and then as a sequence, it lead to calcium accumulate inside the cell. And that is so enough to understand. Right. So the the result will be a positive inotropic effect, which is increase the cardiac output for the patient, also increase the cardiac output for the kidney, which is increase the kidney perfusion. The drug has a negative chronotropic effect. That means the drug can decrease the heart rate. So the drug gives a one efficient contraction with increase the cardiac output, with decrease the heart rate and relieve the stress on the heart. This mainly this decrease in heart rate due to vagal stimulation. The drug activating the vagus nerve, which is a parasympathetic nerve that will lead to decrease the heart rate. طيب نحن we have just 2 minutes. We will complete, and whenever it is stopped, we will return by the same link, inshallah, to complete the lecture. We need more 10 minutes, I guess, more to complete the lecture or 15 minutes. طيب طبعا ديل 2 lecture, one topic in 2 lecture. طيب the pharmacological effect of the drug, the most important is a positive inotropic effect and reduce of the heart rate, which is a negative chronotropic effect. The drug also can cause some sort of the arrhythmia, which is change in ECG, especially the prolongation of PR interval. It can cause a different type of arrhythmia. In kidney, increase perfusion to the kidney, increase the diuresis of the kidney. And in GI, there is important symptoms associated with nausea and vomiting and anorexia. And the patient who develop toxicity early develops these symptoms. So if we give a patient a digoxin and the patient develop nausea and vomiting, we have to check for digoxin toxicity. Don't give a drug which is relieve nausea and vomiting only for this patient. Take the problem seriously. In CNS, also, we have some symptoms appear with the toxicity, especially the yellow vision of the patient. It can cause a CNS stimulation, and in late stage of toxicity, the patient may develop a convulsions and activating a chemoreceptor trigger zone, which is also can cause nausea and vomiting. The drug is used to treat زي ما قلنا atrial fibrillation and atrial flutter in antiarrhythmic drugs and congestive heart failure in patient who has this atrial fibrillation and atrial flutter. We will stop here and we will continue in same link after a while. Any question?
Clear, doctor. Hopefully.
تمام. And I guess it is 1 minute مع يقطع عشان so we will stop the recording.